Every time your child does something confusing that confuses you, frustrates you, or breaks your heart, there's always a clinical explanation for those things. It's not a parenting failure, not a bad day. There's a clinical explanation for it. Nurses are trained to read behavior as data, not as a personal attack. Information the body is sending when it doesn't have better words. Your child has been sending you the data all this time. And today, I'm going to teach you how to read it. I'm Nurse Zee, registered nurse 20 plus years, experience as a pediatric nurse, emergency room nurse, and I'm currently working as a case manager, bilingual case manager for an insurance company. And I'm also the mother of a beautiful special needs daughter that is 23 years old. She's blind, autistic, and has developmental delays. In the ER, we don't ask why a patient is acting a certain way or behaving a certain way. We ask what that behavior is telling you or telling us about what's happening inside the body. There's 4 behaviors. 4 behaviors give you the clinical read behind each one and what to do with this information. So there's behavior 1, which is aggression, which is probably one of the most common ones, right? You can be hitting, biting, throwing, pushing, and the parents, what do they hear? My child is aggressive. But Nurse Zee reads overwhelmed nervous system, fight mode activated. The brain perceives some kind of a threat or a sensory overload or a transition or a hunger or fatigue or anything and found the fastest exit it knows. What do? Don't match that energy. Please don't do that because that's not going to help at all. Instead, you're going to do the opposite of what they're doing. You're going to lower your voice, talk in a low, calm tone, and instead of asking why they did it, ask what happened 20 minutes before this started. That's where the real answer is. Behavior 2 is a shutdown. Shut down, they don't want to talk, they don't want to look at you, they don't want to say nothing to you, they don't want to hear you, nothing. They're still going and they're refusing to respond. What do parents hear? They hear defiance. But Nurse Zee reads, it's a freeze response. System is at capacity. The child cannot comply right now at that time. Not won't, and not. Same way a circuit breaker trips, pushing harder will get you nothing. Backing off will help get your child back. What do? You reduce the demands immediately. Quiet space, low stimulation, and wait for the system to reboot. Behavior number 3, sensory seeking, which could be like spinning, jumping, crashing, mouthing, flapping hands, you name it. What do parents hear? Out of control. My child's out of control. Nurse Zee reads, sensory hunger. The system is understimulated. The nervous system is hungry in a specific way, and your child found the fastest way to fill it. This behavior will not stop until the system gets what it's asking for. What do? Don't stop it. Redirect it. Spinning, swing, crashing, crash pad, mouthing, chew tube, or a chewy snack. You're not rewarding the behavior. You're just meeting the need. Behavior number 4, explosion out of nowhere. You get a massive reaction to a very tiny trigger. The sock is slightly twisted. Oh my God, the day is over. Parents will think, this doesn't make sense. But Nurse Zee reads, there's a full cup. Your child has been managing input all day, and the cup was already full. And the sock, poor sock, was the last drop, not the cause. Stop looking at the trigger. Look at the whole day instead. What was heavy throughout the day? If you empty the cup earlier with the sensory activity, a movement break, a quiet reset, the sock stays the sock. And always remember, behavior is communication. Your job is not to stop it, but it's to understand what the hell they're saying and meet that need. Link below is my library guide to 50 activities of sensory craft activities. I also have the ebook on managing challenging behaviors down below. Check them out. Share this with at least one parent that you know has been calling their child's behavior a problem. It's not a problem, it's a message. And now they have a way to read it. Make sure you subscribe. There's information, new information here every week. Real clinical knowledge for real family.